Do you have pain just below the kneecap when squatting, jumping, or running? If so, you could be dealing with patellar tendonitis or jumper's knee. The way to fix jumper's knee is not rest and ice and relaxation until it becomes more comfortable and then start that activity right up again. Sound familiar? It's actually to modify my activity and progressively overload the tissues so that they can adapt and grow and become more resilient. The important factor here is activity modification so that we stop aggravating the tissue and continue hammering on it. Now, today I'm going to show you 4 exercises that we commonly use in the clinic on a weekly basis with our patients who have patellar tendonitis with a very, very high success rate. First, we're going to do decline squats. So we're going to have a wedge board here and we're going to do slow controlled squats. The wedge board is going to put more load directly on the quads and that patellar tendon, which is going to help create adaptation. What's really important is modifying, like I talked about in the beginning, modifying the load and the depth so that we don't aggravate our symptoms. So with this exercise, we're going to modify the depth so that we don't increase our symptoms. So we're going to start on this wedge here. If you don't have a wedge, feel free to lift your heels up with a couple of plates or a box. And then we're going to put our feet in our normal squat stance here. And then we're going to slowly descend down into our squat, core is braced, back is flat, so we're not doing this. What I want to think about is keeping my weight over the middle of our foot, so where our arches are. And we're going to slowly squat down. We're going to feel that quad tendon load. You're going to stop where it hurts. Then you're going to pause for a second and then you're going to slowly come back up. This is really controlled. We're squatting all the way down, nice and controlled. Notice my tempo, it's really slow. We're building that time under tension on the tissues. We're going to pause for a second and then we're going to slowly return to stance. If we do, that's going to put too much stretch reflex on the tendon and aggravate it. So that tempo is really important. I want to repeat for 12 to 15 reps for 2 to 3 sets. Then we're going to shift over to a wall sit with a heel raise. This is going to help increase the stability and control of our ankle joints and our calf muscles to allow us to better control our ankle and our knee function. Again, with this, our depth is going to be where we're comfortable. So the standard wall sit is 90 degrees, but if your patellar tendon gets aggravated at 60 degrees, then maybe we stay a tiny bit higher than that. So we're going to be on the wall. Our feet are going to be about hip width apart. And then we're going to drop down into that wall sit here. When we come down into that wall sit, we want to make sure our feet are far enough away that our knees don't jut forward on our toes here, but they're not too far out to where our knees are way behind my ankles. So a good cue is to keep our shins vertical here. So we're going to drop down in this position. Head stays on the wall, back stays on the wall. And then we're going to stabilize here. And then we're going to lift the heels, squeeze the calf. You're going to feel a little bit more burn through that quad there. And then we're going to slowly lower back down. We're going to go nice and controlled. We're going to repeat this for 12 to 15 heel raises for about 3 rounds. The next exercise is the reverse Nordic curl. This is going to help strengthen that quad muscle again and put load on that patellar tendon while we're going into the lengthening phase of the tissue here. This exercise is relatively difficult, so I like to have some straps here so that I can use the straps to help aid me as much as I need so that my patellar tendon doesn't get flared up. Also, I like to have something that's kind of soft and squishy to kneel on, just because that direct pressure sometimes can aggravate the patellar tendon where it attaches to the kneecap. So we'll be in this kneeling position here. And what's important is that my hip joint stays straight as much as possible through this. So we don't want to be sitting back on our heels like this, just rocking back and forth. What it's going to look like is we're here, we're kneeling, our hips are trying to stay open. We're going to lean slowly back. And again, we're going to control this nice and controlled, but also go only as far as what's comfortable. And when we get back, we have this strap here. Again, you don't need the strap. And you're going to try and use your quad muscles to help pull you back up. If you need assistance, please use the strap to help take some of the load off, but we can still load the tissue into that lengthening phase and come out of it just with the assistance from the strap there. So again, this is what it's going to look like without the strap. We're in this kneeling position. We're going to rock all the way back. We're going to get to a nice, comfortable position. You might feel a stretch. Pause, and then you're going to pull yourself back up using your quad muscles, nice and controlled. We're going to repeat this for 6 to 8 reps for about 2 to 3 sets. This last exercise is a single leg med ball squat, but modified. So I'm going to show you a couple of modifications so you can see it here. So basically what we're going to be doing is the foot that we are trying to actively work is going to be the front foot. The back foot, we're just going to have a toe down so that we can stabilize so we don't fall over. A big thing to look at is this knee angle here. As we're controlling the depth, I don't want the knee to cave in here, so control the valgus stress on the knee, okay? So what we're gonna do, we're gonna take this ball here, we're gonna stand on the wall so that the ball is about mid-back here, like touching our mid-back here. Our feet are going to be just a little bit forward, so we have the tiniest bit of bend there, okay? And then I'm working the right leg, so my left leg is gonna be stepped back. I'm just barely gonna have that toe down, okay? So then what I'm gonna do, I'm going to use and lean into this ball here, and I'm going to sit back against this ball. What that's gonna do, I'm slowly going to be hinging at the hip here, but I'm still gonna feel a big quad load here on that front leg, but I'm gonna be using this ball, okay? So you're gonna feel it engage in this hip, you're gonna feel it in this quad working really hard. You're gonna pause for a second, and then you're gonna slowly stand back up, re-engage the quad. Then we're gonna slowly sit the hips back all the way, use the ball. Notice how I'm using the shape of the ball to help my descent, so I'm not like this upright, right? I want my back completely flat. So as I'm going back, my back tucks under where this ball is. We're gonna pause there, and then we're gonna slowly drive back up through that front leg, trying to keep the heel down. We're gonna repeat this for 6 to 8 reps for 3 sets on each leg. For tendon injuries like patellar tendonitis, a little bit of discomfort and pain during the exercise is okay, but pain shouldn't significantly increase after and into the following day. Slowly increase the load gradually tends to work better rather than increasing the amount of load very, very quickly and then struggling and then having to have a setback for a week and then slowly working our way back up to that weight over the next month again. It's easier to just slowly trickle and climb your way up to build that progressive overload. If you're dealing with jumper's knee, try adding these exercises into your routine. If this helps, like and subscribe. And drop a comment below to let us know if this helped you.
Drop a comment below letting us know how it went.
Valley Rehab Physical Therapy and Return to Work Center.